So dental veneers or tooth veneers are a very thin shell of ceramic. Usually they are a fraction of a millimeter in thickness, and they are glued to your front teeth to improve their color and the shape. So basically, there are thin shells of ceramic that are glued to your front teeth to improve the aesthetic of your smile. What do they do? A lot can be done with dental veneers. So let's say, for example, that you already tried the tooth whitening, but you're not happy. You're still not happy with the color of your teeth, and you want whiter teeth. Or, for example, you were born with stained teeth, or you develop stain throughout your life and you cannot get rid of them, no matter how many times you try with the whitening and professional cleaning. Or you want to build up your teeth because they got worn over the years. Well, let's say that dental veneers can do all of this. They can they can make your teeth as white as you want. They can build up your teeth to the shape you want, make them nice, straight, and with the original shape they used to have in the past. And they also can straighten your teeth if you do not want to have orthodontic treatment. So dental veneers, in a very simple word, can help you achieving the smile you always wanted. So briefly, the process of placing dental veneers is divided in 3 steps. In the first step, I usually meet up with my patient. We get to know each other. I like to talk to them, see what their expectations are, what they want to achieve, and what their goals are, and especially what kind of veneers design they want. Some patients, for example, they just want to build the teeth up as they were in the past. Other patients, they want to protect their teeth because, for example, they are broken under fracture as a consequence of a trauma. Other patients, they want to have the so-called Hollywood smile when they want their teeth to be straight and white. So during this first consultation, we discuss patient expectation and what they would like to achieve with dental veneers. And of course, I will always also carry out a dental exam where I'll be checking if the patient mouth is free from disease, such as cavities and gum disease. On the second step, and during the second appointment, I will be preparing the patient teeth to receive the veneers. So if the patient teeth are already worn out and need to build up, almost no shaving of their teeth is needed, and usually only a scan or an impression is needed. But if a patient, for example, wants to cover their teeth because they have stain or they want to improve their color, but their teeth are not worn down or broken, then a very likely, a small shaving of their teeth is requested. Usually, again, as I said, a fraction of a millimeter. This is the most important and most critical step for providing dental veneers, and only a qualified dentist should perform such procedure. At the third appointment, last and third appointment, we will be gluing the dental veneers to your front teeth. If a patient is very busy or they come from quite far away, they don't live in London, we can carry out the whole treatment into appointment. We can have the first consultation online, so I can get to know my patient online and have a chat. And then at the second appointment, we will be preparing the patient teeth to receive the veneers at the first appointment, and at the second one, we will be gluing them. So veneers, they last on average from 7 to 9 years. So the pros with veneers, obviously the most important pros of veneers, it is that they can greatly improve the aesthetic of your smile and boost our confidence. And in some cases, I have to say, I've seen my patient, their life really changed, the quality of life really changed significantly after having veneers. I've had patients, they hadn't smiled for 15, 20 years before having veneers. And after they had the veneers done, they finally got the smile they always wanted. And all suddenly they start smiling again, and this really boosted their confidence. So the most important pros of veneers, it is obviously that they will significantly improve the aesthetic of your smile and boost your confidence. But veneers is not only a cosmetic treatment. In case a patient teeth are worn down or broken as a result of trauma, or worn down because a patient grinds or because of gastroesophageal reflux disease, veneers can also protect the patient teeth and make them less sensitive to hot and cold. Cons of a veneer: if the veneer is done by a qualified dentist who has had a further training in this field of dentistry, cosmetic dentistry and veneers, the risk and the cons are very small. But if a dentist who's not experienced in such procedure will carry out veneers, then the risks are significant, such as the permanent toothache, permanent sensitivity to hot and cold, and in some extreme cases, even tooth loss. So I would advise any patient who want to have the veneers done to check the dentist qualification and see if they have done any further training in such procedure. Because usually, and I'm saying that because I also taught undergraduate. In undergrad and dental school, this procedure is not taught really well, is barely taught to students. So it's something that doing veneer is something that you learn after you graduated. And you have to check on the dentist profile if they've done any extra master or any extra course on this field, or even better, if they are specialists in prosthodontics, which is the field of dentistry, the specialty of dentistry that deals with cosmetic and veneers. So, as I was saying before, if this procedure is not done properly, they can definitely damage your teeth. And this procedure has to be done by a qualified specialist using the proper equipment, such as a proper magnification and proper instrument to perform such very delicate procedure. But if all the guidelines and rules are followed, the dentist is qualified in doing such procedure, then the damage to your teeth is close to zero or very, very minimal. So in London, on average, tooth veneers can cost as little as £600 to £700 to about £1,200 to £1,300 per veneer. So this is quite a big difference, a big gap in terms of cost of veneers, and many factors can affect the cost of a veneer. But two are the most important factors that can affect the cost of veneers, which are the material the veneers are made of and the dentist who's providing such treatment. So all veneers are made out of ceramic, but not all ceramic are the same. There are some ceramics that are stronger and more beautiful than others, but unfortunately, such ceramics are more expensive as well. And the other factors that can affect the cost of the veneer significantly, it is the dentist who's providing such treatment. If it is a general dentist who hasn't had any extra course, as I was saying before, on this procedure, usually the fees tend to be lower compared to a specialist who has done a 3 years full-time program on top of his dental degree, just focusing on cosmetic and aesthetic procedure. So a specialist like myself will charge on average more than a general dentist, but on average the result is more predictable and much safer.